Brittany Maynard passed away on November 1st, 2014 by taking a fatal dose of barbiturates. Brittany was diagnosed with a fatal brain tumor and was told that her cancer would likely kill her in 6 months. The brain tumor caused seizures, severe head and neck pain, and stroke-like symptoms. Brittany said she had no intention of allowing this disease to control how she lived or how she died. Brittany made this choice under the Oregon Death with Dignity Act. This is also known as euthanasia or physician-assisted suicide. This is the painless killing of a patient suffering from an incurable and painful disease or irreversible coma. There are only 6 states where euthanasia is legal, and there is a great deal of controversy that surrounds it. Should euthanasia be legal in all states, or should it be banned in all states? During this speech, we will see that euthanasia is not just an alternative form of suicide. It is a simple way for those who are suffering from a terminal disease that will end their life within 6 months. There are many different regulations for how someone can carry out euthanasia. There are also those who will go against euthanasia. They think that it is against the Hippocratic Oath, as well as that legalizing euthanasia will lead to legalizing murder. Brittany Maynard's story will help us to understand euthanasia more as well. Again, euthanasia is the painless killing of a patient suffering from an incurable and painful disease or irreversible coma. Euthanasia should be considered a legal option of anyone who is suffering from an incurable disease, the operative word being incurable. One difference that should be noted is that physician-assisted suicide is when the physician provides the means for death, most often through a prescription. Euthanasia is generally when the physician would act directly by giving someone something that would end the patient's life, for instance with lethal injection. However, within this speech, they will be used as one and the same, as a way for a patient with a life-suffering disease to be ended. First, according to euthanasia.procon.org, there are 5 states that allow for euthanasia or physician-assisted suicide, which are California, only after 2015, after Brittany Maynard had passed away, Colorado, Oregon, Vermont, Washington, and the District of Columbia. It also states that each state has its own set of policies which must be followed, but they are all fairly similar. Patient eligibility is that all patients must be 18 years or older. They must be a resident of the state where euthanasia is legal. They must be capable of making and communicating health care decisions for him or herself and must make the request voluntarily. They must be diagnosed with a terminal illness that will lead to death within 6 months. The physician protocol is that the physician's diagnosis must include a terminal illness with 6 months or less to live, and that the patient is mentally capable of making an informed decision and is making the decision voluntarily. The patient must be referred to a consulting physician to confirm the diagnosis and competency. The physician must discuss the medical diagnosis and prognosis for 6 months or less to live, along with additional treatment, the risk of aid in dying medication, and the possibility that the prescription may be filled but does not have to be used. The patient must be referred to a licensed mental health professional, and the patient must notify their next of kin about the prescription request. The patient request timeline is as follows. The first oral request is made to the physician. There's a 15-day waiting period. The second oral request is made to the physician. Then there is a written request to the physician, a 48-hour waiting period before picking up prescribed medication, and then picking up the prescribed medication from the pharmacy. With these regulations, it shows that just because you want to die doesn't mean that you can. Simply make an appointment with a doctor and ask for a life-ending prescription medication. There's a system that we must go through. We will use the example of Brittany Maynard. During an interview with CNN, Brittany explained that she was diagnosed with a fatal brain tumor and told that her cancer would likely kill her within 6 months. She was having long seizures, severe head and neck pain, along with stroke-like symptoms. She was a native of California, but California did not legally allow for physician-assisted suicide at the time. So she moved to the city of Portland in Oregon so that she could pursue physician-assisted suicide. Brittany had a partial craniotomy and a resection of her temporal lobe in an effort to stop the growth of the tumor, but this didn't work. Her tumor came back and it was more aggressive. Because of how large the tumor was, her doctor had prescribed full brain radiation. The side effects? The hair on her scalp would be singed off and her scalp would be covered in first-degree burns. She thought about hospice care, but her pain could be morphine resistant and she could suffer personality changes as well as a loss of verbal, cognitive, and motor function. Brittany saw this as a nightmare scenario and started to research her options. She then found physician-assisted suicide, where she could receive a prescription from her physician for a medication that she could self-ingest to end her dying process if it became too unbearable. Brittany met the criteria that the state of Oregon required, but she had to establish residency in the state. She had to find new physicians, search for a new home, obtain a new driver's license, change her voting registration. Her husband had to take a leave of absence from his job just so that he could be with her. As a review, Brittany fulfilled the requirements that Oregon required. She was over 18 years old. She had become a resident of Oregon where euthanasia was legal. She was capable of making decisions, and she had a terminal illness that would leave her dead within 6 months. I know that if I was in Brittany's case, I would want the choice to end my life. I think that anyone in her shoes should have the opportunity to end their life. If she has decided that she doesn't want to live with the horrendous side effects of the only treatment available, she shouldn't have to. A major point that Brittany made was that she was not suicidal. She had the medication for weeks, and she did not want to die. But she was dying, and she wanted to die in her own way. Brittany said that if she decided to change her mind about the medication, she would not take it, but if the suffering became too great, she would be able to end her pain. Brittany is quoted saying, "I'm not killing myself. Cancer is killing me. I am choosing to go in a way that is less suffering and less pain." She didn't like the word suicide, calling it incorrect. "I am already dying from cancer. I don't want to die." People who commit suicide are typically people who want to die. There is no reason someone should be able to tell you you can or cannot die. This shouldn't be a chance for people to commit suicide. This should be a chance for people to end terminal suffering the way they want to. Brittany choosing to die had caused a great deal of controversy. A 30-year-old who lived in North Carolina said that Brittany's decision was anything but brave, urging her to reconsider and insisting that suffering is not worthless and that our lives are not our own to take. This North Carolina resident isn't the only one who is against euthanasia. Leon Cass, who has an MD and a PhD, said at a committee meeting on social thought in the winter of 1989 that the prohibition against killing patients stands as the first promise of the self-restraint sworn to in the Hippocratic Oath, as medicine's primary taboo. "I will never give a deadly drug to anyone who asks for it, nor will I make a suggestion." Leon Cass makes a very good point. Doctors are to save lives, not to take lives, even if the patient has asked you to. Patients could begin to worry about whether or not their doctor was actually trying to save their lives. However, Philip Nitschke, who also has an MD, said over time the Hippocratic Oath has been modified on a number of occasions as some of its tenets have become less and less acceptable. The much-quoted reference to do no harm is also in need of explanation. Does not doing harm mean that we should prolong a life that the patient sees as a painful burden? Surely harm in this instance is done when we prolong life, and doing no harm means that we should help the patient die. Killing the patient? Technically, yes. Is it a good thing? Sometimes, yes. Is it consistent with good medical end-of-life care? Absolutely, yes. Edmund D. Pilanjario, who also had an MD, said that euthanasia is a slippery slope to legalized murder. Assisted suicide is a halfway house on the way to other forms of euthanasia. Is voluntary euthanasia a halfway house to involuntary and non-voluntary euthanasia? If terminating life is a benefit, the reasoning goes, why should euthanasia be limited only to those who can give consent? Why need we ask for consent? Edmund brings up a great point. If we allow physician-assisted suicide to be legal, then what is to prevent us from killing anyone that we think deserves it? What if a double amputee decides that they don't want to live anymore? Then they can commit euthanasia. What if a child decides that they don't want to take care of their Alzheimer's suffering parent anymore? This can become a very slippery slope. In the end, euthanasia or physician-assisted suicide should be allowed in all states. No one should have to experience the suffering that Brittany did when she had to move from her hometown just because she wanted to end her pain and suffering from a life-ending disease. With regulations that keep people from using euthanasia as a form of suicide, this should be a perfectly legal option. It will also keep the slippery slope of legalized murder at bay. And while for some it may go against the Hippocratic Oath that says do no harm, for others it is preventing just this. Euthanasia should be a legal option for anyone who is suffering the way Brittany Maynard was. In the end, Brittany Maynard was able to live out her life the best way that she could.